One of our priorities at St. Francis is to integrate the care teams across multi-specialties. You know, in this day and age, with medicine being so advanced, there are no physicians that can cover the length and breadth of cancer care. And so that's why we have specialists like myself who are medical oncologists, in addition to radiation doctors, radiation oncologists, surgeons, and then there are other specialists that are involved as well, radiologists that interpret x-rays, pathologists that interpret tissue biopsies. It's very important to have all of those people communicating.
Oftentimes the treatments happen simultaneously. It's not all that unusual that a patient has to receive chemotherapy and radiation at the same time to be followed within a specific time frame by a surgical procedure. That has to be choreographed exactly correctly, and without the communication that makes that happen, it just won't, and the patient suffers as a result.
One of the priorities that we've placed at St. Francis is meeting together as a group to go over cases, to talk about difficult situations, to explain to patients later, hey, this is what the group consensus was. We have 4 different multidisciplinary tumor boards that are all for different specialties. Actually, we've got other groups beyond that as well, but we have breast cancer tumor boards or multidisciplinary conferences. We have thoracic or lung tumor boards. We have gastrointestinal tumor boards, genitourinary tumor boards. So all of those are geared towards specific cancers, specific specialties that are identifying patients that may need input from multiple different doctors.
The role that I play as a radiation oncologist is to bring the expertise of my field, radiation oncology, to bear at the time of the conference. So whereas people in other fields may not know all of the data of the studies that have been performed within radiation oncology, that's my responsibility to be able to communicate that information. And really, each doctor from his or her discipline brings that same expertise. Then we sit around a table together and we can talk about these patients and eventually come to a consensus about what we think is the best care for that patient.